All right, then, this is your India COVID tracker. Let's quickly race past the latest numbers by you. At least 564 new COVID-19 cases were reported in a single day, taking the total number of active COVID-19 infections to 4,866, with Kerala accounting for the highest number of infections at 1,373. And in response to the rising case count, Kerala Health Department has issued directives to all the government and the private hospitals. Maharashtra has logged about 510 cases, Gujarat 461, and West Bengal 432, with 100 cases being recorded in West Bengal in the last 24 hours alone. The national capital has recorded at least 457 COVID-19 infections so far. A total of 51 COVID-related deaths have been reported in the country since the 1st of January, the highest being in Maharashtra with 14 fatalities. Meanwhile, West Bengal reported, like I mentioned, 100 new COVID-19 cases according to official data available on Thursday morning, and this takes the active cases in the state to 538. 14 fatalities in Maharashtra, total fatalities standing at 51 since the 1st of January, about 4,000 plus cases that the country is dealing with. And amid the rise in the COVID cases across India, News9 spoke with Professor Amita Gupta, Director, Center for Innovation and Infectious Diseases Research, Education and Training, the CIIDRET at the University of Delhi. Dr. Gupta said that the new COVID variant is less severe but spreads faster than the previous strains. Listen in.
Today I have with me Professor Amita Gupta, Director, CIDRET, Delhi University. She will be talking to us regarding how effective current vaccines are against COVID-19's new variant. Thank you for joining us, ma'am. Ma'am, can you tell us how effective these vaccines are against the new COVID variant?
So the new COVID variants that have come up and are circulating right now in our country and worldwide are less severe in causing disease. They spread faster, but the symptoms are less severe, and therefore there is no need to panic. They have one or more mutations in the spike protein. Okay. However, the larger part of the spike protein is similar to the previous variants, and therefore there is a chance that the current vaccines will remain effective against the new variants also. However, the protection which is given by these vaccines is not very long-lived. That is why there is a need to take booster shots to renew the immune responses so that the new variant can also be taken care of.
Right, ma'am. Ma'am, experts are saying that COVID has become an endemic. Would you agree to this?
So, endemic is being said essentially because COVID is now not coming up as serious outbursts, but it is something which is remaining in circulation, okay, with variants coming up. So from that point of view, it can be said that it is no longer an epidemic or a pandemic. However, to say that it is endemic, that should not be taken as saying that it is now mild and we should not worry about it. We should still be aware of the fact that it is there in circulation. Okay, it does cause symptoms that need to be looked into. Therefore, if anybody experiences symptoms of COVID, it is important that they go for testing and they try to separate themselves from the other members around them.